During the pandemic, there was a lot of uncertainty. It was apparent that people were going to be affected both psychologically and or mentally in terms of how they were going to cope with this. My name is Dr. Peter Phiri. I'm the Research and Development Manager at Southern Health NHS Foundation Trust, where I head a research department and a team of researchers who conduct both national and international research. My first love is, caring for people, which is one of the reasons why I do research. So for me, patients are always at the center of research. So I don't think I'll ever leave that. So when the pandemic began, our research team sat down and drafted a proposal, and this really was aimed at looking at the psychological impact of COVID-19 pandemic to help facilitate how we can deal with this, but also for future preparedness as well. We used the general anxiety questionnaire, and then we also had the impact of event scale, which once again measures the psychological impact of going through an event and so tends to pick up some post-traumatic stress symptoms. We also explored depression, loneliness, and alcohol use as well, and how that impacted their well-being. In order to improve people's well-being, I think we should care about their psychological well-being. I think as much as we care for people's physical health and well-being, because we know the burden of mental illness. SAP tools like Qualtrics are really, really important for clinical research. They've allowed us to run clinical trials during difficult times where there were restrictions. They've allowed us to reach as many people that normally wouldn't probably be able to take part in research. For this study, we knew that Qualtrics was the right platform for us because it had high security. When participants take part in trials, they want to feel confident that their data will be maintained in a safe way. And that's one of the key factors of the platform. What was interesting in terms of the impact on just one participant was how, by completing the psychological impact study questionnaire, it allowed them to realize how unwell they were. And for them, they felt that it really changed their life because it meant they're now receiving help. That is one of the things that really makes us proud in terms of why we do research, because it's about research having impact on the individuals that take part. The ease of working with Qualtrics Core XM is that I can assess the progress of how my study is doing, and I can log in on the app. I can see how many participants are responding to the study live. So it makes it easy for me to have real-life data on the go. It is important for the NHS to embrace technology, but where technology becomes useful is that it then allows more time with patients, which is what really staff want, and this is what patients want as well. But also it means that things are done effectively and efficiently. The overall response has been extremely positive. The work has been published, our work has been included in the World Health Organization global literature. Now you've got the data that will allow you to say, okay, this is what happened before, this is what we need to do in order to make sure that we reduce the impact on the populations that we serve.